I can say this to the colleagues from Philips, you hear all the accolades because in a month's time we go into a performance management review. So I just want to make it sure that we just need to see it in that context as well, But thank you for the kind words, Craig. It's really appreciated. Let me also use this opportunity to extend a special word of welcome to all here today. We know you all had to take time out of your diaries, very busy diaries, to be here with us. Colleagues has travelled from what we refer to the other side of your escape from Pretoria to be here with us. We really do appreciate it. And so from the members from the Executive Leadership Group, Philips colleagues, all the other colleagues, as Craig has indicated earlier, we really appreciate you sharing this wonderful occasion with us here today. But also allow me at the start of my little talk just to both thank the Department of Higher Education and Training, as well as Philips, for their contribution for us sharing this opportunity here today. And as has been alluded to by the colleague from Philips, this is a unique facility that we are going to look at here today. And we do want this to be a life-changing event in the lives of students, not just students, practitioners as well, and I'll refer to that a little bit later. Ladies and gentlemen, South Africa, as many other countries in the world, face significant challenges related to healthcare delivery. It remains a real concern in South Africa that despite contributing 8.4% of GDP to healthcare, we are not achieving the desired outcomes expected with the investment made. We do not compare well with other countries in the world, especially in the domain of maternal and child health, as has been alluded to as well by the colleagues from Philips. This is a specific focus for Philips Healthcare. And the first time that we really met was one of these Cape to Cairo drives 4 or 5 years ago. And it's really wonderful where we've ended up here today. But just to illustrate the point I'm trying to make, I'd just like to use an example of Bangladesh. That has 3 times our population, spent less per capita on healthcare, but has better outcomes in maternal and child healthcare. So we need to look at these issues. And there are various reasons for these outcomes, both structurally and operationally. And the following are some core challenges experienced worldwide in the training of healthcare professionals. First of all, we talk a lot about it, but there's limited inter- and multidisciplinary approaches in teaching and learning. It's a lot of spoken about, but it doesn't really happen in practice. Very important aspect worldwide, insufficient time on the clinical training platform to enhance core and other clinical competencies. Poor communication between various service providers, insufficient staff to oversee and facilitate clinical training with the shortage of skills in various domains. South Africa especially, we've got a shortage of medical practitioners, nurses, so it does impact through on the clinical training platform when we have a number of students that need to go through these systems. And then very important, the so-called insufficient attention to the so-called soft skills, such as bedside manners and communicating with patients. With the allocation of the clinical training grant to universities without medical schools a couple of years ago, a key consideration for us at UDA was how we're going to optimize this allocation to really contribute to the enhancement of clinical skills in various domains. Many universities use the grant primarily for adding additional staff, but our approach was to rather look at sustainability for the future. Another concern was the ethical implication of students interacting with patients before they had sufficient practice and time to display a required level of competency. And this was a real concern for us, especially in our clinical domains. When do you, excuse the term I use, but when do you release the student to really go and practice on a patient, on a real life patient? Because there's an ethical aspect around it if they're not truly prepared to deal with that. Our decision was to optimize the clinical training grant in equipment and facilities with some allocation for staff to enhance the clinical skills development area. I need to highlight that simulation learning is not a new concept in South Africa. In our endeavors, we looked at various options available nationally and internationally. We found numerous facilities, and although all of them provided opportunity to enhance clinical skills, none provided an environment that simulated the real workplace, the real work environment. So with a number of my colleagues, with the idea developed of introducing a real world of work environment. And off we went to Chris Hani Baragwanath Hospital, looking at trauma, casualty, a general ward, ICU areas. Look what's available there, how is it equipped, and a range of other issues. So the idea developed to have a pre-hospital care area for emergency medical care, leading into a trauma area, followed by an ICU bed and a general ward. The picture evolved, and what you will see today is a clinical simulation facility that truly replicates the work environment in real life. So it's not just a structured block where we do some activities, it's a flow of activities. We also address the concerns that I've highlighted previously in that there will now also be an opportunity to assess communication skills between disciplines. For example, when a patient is transferred from the pre-hospital care domain to casualty, from casualty to ICU or the general ward. The patient, obviously, in this case, is the mannequins. Opportunity is also created for radiography and medical laboratory sciences to be involved, and the interpretation of results and as well as record keeping will form an integral part of students' activities within this facility. The notion of interdisciplinary teaching and learning will be enhanced, with students also exposed to lecturers across disciplines, which we feel is a very important aspect to look at in the South African situation. The skills practice area also allows students to practice various skills until competency is achieved, together with software and other support. Ladies and gentlemen, I do think our students and staff are privileged to have this facility available. We have an investment currently in excess of 20 million rands, just in this venue behind you here, with one core focus in mind: to produce the most competent healthcare providers in the related domains in the country. And that's what we want to do. There's no challenge around those issues. Challenge is to change the page. In summary, let me clearly state that the intention of the simulation facility is not to replace real-world learning or training. It is indeed to develop the core skills with confidence, underpinned by an ethical foundation to provide excellent service to South Africans and enhance our achievement levels of specific indicators. We will also use the facility to enhance capacity with practicing healthcare providers in the form of continuing professional development. The need for upgrading of skills of current practitioners cannot be underestimated, and together with Philips Healthcare, we have created an opportunity for exposure to leading international renowned technology and innovation. The College for Emergency Medicine is already using the facility for the final examination for related specialists, and we have trained doctors and nurses from 10 African countries on diabetes management utilizing the facility. As a young, vibrant university looking forward to celebrate our 10th birthday, we're not yet 10 years old, we are convinced that this facility will contribute to our university's strive to be an international university of choice, anchored in Africa, dynamically changing the future for everybody in South Africa, with a clear understanding to be in the top 3% of universities worldwide in the near future, up from our current status of being in the top 4%. I thank you for your time and attention.